You're watching WNWO.
Did you know approximately 75% of the U.S. population has some form of gum disease? That number directly correlates with the high statistics of Americans who have cardiovascular disease, which is the leading cause of death in the U.S. regardless of gender, race, age, background, and even income status. We are talking today to Dr. Nadim Khan of Great Smiles Family Dentistry on how to protect your teeth, your gums, and keep your heart healthy. So grab your toothbrushes. It's time to brush up on your heart health. Would you go into a little more about that? Why this is such a life-saving effort, and it's very simple to do.
Oh, it's amazing. I mean, there are people out there that are saying that flossing will actually save your life. And a simple thing as a toothbrush or floss, maybe a couple of bucks you spend at the pharmacy or at the grocery store can actually help save your life. And how does that happen?
Right.
Well, let's go into the sciences of it. Basically, the sticky white bacteria that people have in their mouth, it's called plaque. That can actually enter your bloodstream from the mouth. Now, that is not the actual plaque that people find on the arteries or on the heart. It's a different type of bacteria.
Okay.
However, it's sticky, and that can bond, if you will, or glue on to the fatty plaque that we might have in our arteries, and then attach to that and actually start clogging up those arteries, which can actually lead to heart disease. In fact, if you have periodontal disease or gum disease, you have twice the amount of chance of getting heart disease, which is amazing. So just simply going to your dentist and getting a checkup twice a year and flossing and brushing at least twice a day will actually help save your life. Brushing, whether you're doing it manually or whether you're doing it with an electric toothbrush, is very important. So the manual toothbrush that we recommend is a soft bristle toothbrush.
Why is that?
Because it's not as hard on your teeth. It won't erode the enamel or the outer protective layer of your tooth, and it also won't abrade or erode your gum tissue away from your teeth. So using a soft bristle toothbrush will be gentle to your gums, gentle to your teeth. You gently massage it and you're able to remove the plaque and tartar buildup with it. Now an electric toothbrush is actually even better because the brush actually does all the job for you. Okay. It actually has, in this case, the Sonicare, which has sonic waves that go about 2 to 3 millimeters beyond its bristles, will actually go between the gums, below the gums, and actually help loosen up the debris. It doesn't substitute flossing. We want to, again, emphasize that flossing is very, very important, and you really need to floss. In fact, 75% of the population in America has some sort of gum disease, whether it's gingivitis or periodontitis. 75%, as stated by the American Periodontal Association of America.
And that's something that is direct correlation with heart disease, we're saying.
Absolutely. And again, like you mentioned, exercising, losing weight, eating right are very important. But we're also saying flossing and brushing and following through with your dentist is very important.
Now, what are the signs? So let's say I've been going to the dentist. What are the things when someone comes in to see you for the first time or they're a regular patient, are you looking for to know whether or not they need extra help or care with their teeth as far as plaque buildup?
What we like to do is at least once a year, we like to measure the spaces between their gum and their tooth. That's one indication. Another indication is maybe a foul odor from the mouth.
Oh, that's not exciting.
That's not exciting at all. It also hampers your social.
Right.
It also hampers your social activity too.
Right.
The other issue is that bleeding gums, red, puffy, swollen gums. Those can also be indicators that there is some sort of gum disease, or maybe the beginning of gum disease. That's standard of care. That's very important, because if it isn't appropriate or it's not at the normal levels, then we either will recommend a deeper type of cleaning, maybe we'll recommend an electric toothbrush, maybe some antibiotic therapy underneath the gums, and then worst case scenario, If it's very significant, we'll maybe recommend a referral to the gum specialist to maybe consider some gum surgery if necessary.
Okay, one of the things I had done, because I was very afraid of the dentist, had some very bad experiences, and I hadn't been to the dentist in about 3 or 4 years, and the first time I visited you, I was told that and I had to have scalings done. So something like that definitely stopped me from ever not coming to my dentist again. So I'm going to have you explain one of the things, I guess that's one procedure that can be done here to help you where you clean below the gum line and that.
Correct. I mean, basically, what happens is, like we talked about the bacteria, it's in the mouth, it's sticky bacteria, and basically what that is called is plaque. And essentially, I'll use my big toothbrush here.
That is a really big toothbrush.
Yeah, it's for big people here. So basically what happens is when you first have signs of plaque buildup around your gums, it may appear this way. And a lot of times that can be removed with just simple brushing, flossing, and of course your regular cleanings. However, I'm going to flip this around. Over time, the plaque can harden up and turn into something what we call tartar, or calculus buildup.
Okay.
And that goes below the gum, as you can see, and it starts to erode the bone away. So if we go back to the original picture, we have nice, healthy bone around the tooth here.
Okay.
Nice, solid bone. However, once the plaque starts to turn into tartar, it goes below the gum and starts to erode the bone away. Consequently, the teeth start to loosen up. That's also another indicator that there might be some significant gum disease going on. Now, when the teeth are starting to loosen up, it might be too late where a simple cleaning is not enough, where we may have to do either A, like you said, the scaling and the root planing, which is basically translated as deeper cleanings, where we're going below the gum and removing the plaque buildup and the tartar buildup. However, we can give some anesthetic and laughing gas, and that would definitely help create a more easier environment. But basically, if it gets to this point where there's a significant amount of bone loss, that's when we'll probably make that referral to the gum specialist and have them maybe do a little gum surgery around there to help stabilize that area.
Where you're offering new patient special with anyone all the viewing audience out there, so they can get in and take care of that. Tell us about that.
Well, basically, again, taking care of your mouth is very important, because a lot of times people are scared when they come to our office, so we like to show them that, hey,
laughing gas.
Exactly, laughing gas works. No, we actually like to educate patients about good oral health, and if we start building a good foundation from the beginning, as they get older, it gives them confidence, and it also prevents further, as we discussed, medical complications.
We'd like to thank you, Dr. Khan, for joining us here in the Fit Zone.
You're very welcome.
Being our first guest.
I appreciate it. It was great to be on. It was a great show.
Great to have you. And
thank you.
I hope that our viewing audience will come and check out Dr. Khan. You can either call his office or go to his website. You can also visit my website where you'll see Great Smile Family Dentistry. Click there and get in touch with Dr. Khan and take advantage of the new patient special you're offering.
Absolutely.
Come back for the second segment. We're going to be offering you a way to cook up some tasty treats at home. So come right back. We'll be here waiting in the Fit Zone.